Greetings to you all lovely people. So today's discussion would be about a writing lesson, a live discussion about a writing. Now, before we move into that, I would like to cover a short session which says about like what is OET writing and what we need to keep in our mind when we read a case note, an OET case note when you get in your examination. How should you be able to tackle it? How should you be able to formulate it? This is something what we are going to learn today. So I'll share a small presentation which will help you to understand how the timing is being distributed, how to use the initial 5 minutes if you really want to actually take the most important informations and try to understand what this letter is all about. This time management will definitely help you. And 40 minutes is given to you for writing a beautiful letter of 180 to 200 words. Now, when you're writing this letter, you have to be very careful. You need to be very sure that you know the target reader's point of view. Who is the person to whom you're writing? What kind of information would make relevance to the person who's reading? And the flow should be beautiful. You should be able to summarize the information the way you need it, the way the target reader would require. Okay, this is something what we need to understand. Now I'll just share a small presentation which will help you to understand in a much better way, I would say. Okay, here we go. Now let's play this up and let's try to understand how the things would work for you. Now, these are the 4 common types of letter. Now for medicine, for OET medicine, maximum times, 90% of the times, you will get a referral letter. But for other professions, you can get a transfer letter, you can get an advisory letter, especially for nurses, they may get all the 4 types of letters. So you should be prepared with it. How to write a referral letter, how to write a transfer, how to write an advisory letter. See, there is no fixed structures as such, like there is a particular kind of structure or a particular style of writing. You just have to make sure that you understand who the person to whom you're writing. Is it a medical person, non-medical person? What kind of person he is? If he is able to understand your information, what you're writing, and you're able to understand what kind of information he would require, then things would be pretty easy for you. Now, let's understand this, the time limits which is given in your OET letters. Now, on top of your question paper, you will see this information, writing subtest. Now here I've taken nursing, but for medicine also it remains the same. Time allowed, the reading time is 5 minutes. There is initial 5 minutes, they give it to you, where you need only to read the question paper. You're not allowed to touch your pen. You're not allowed to make any notes. You're not supposed to do anything. This is the time where you should read your question paper carefully. Don't waste your time or don't try to be oversmart by just making points, utilizing the time to make underline things, make notes. No, don't do that. Just be calm in this initial 5 minutes and wait for the time to go and just read, go through each and every details, each and every information which is given to you. Now, how to read a letter, how to utilize this 5 minutes, that is something which I'm going to teach you. I'm going to show you in live lesson how that would be helpful. Many people say it is debatable that this technique would work, but I can assure you this definitely works because I've seen what students see. How do I measure my technique that whether it works or not? With results. So when I get good results with this, I know that, okay, fine, this technique is working well with the students because there is no fixed structure. There is nothing fixed in OET letters which will tell you like this is the way you should write, these are the only words you should use. There is nothing like that. If the reader feels the flow is good, you have understood what kind of target reader you have and you've understood his point of view, you've taken all those relevant information only which is required, you have done your work and nobody can stop you from getting grade B or grade A. Nobody can stop you. You should have good grammatical ranges, but you should have better understanding of the given prompt as well. That is also required. Okay. Now, how to read a case note in the first 5 minutes. When they give you the first 5 minutes, make sure this technique you can use it. This will definitely help you. I can show you it on a live case note as well. After the next slide, I'll show you on a live case note. By reading this way, how can you be very sure that you're taking information according to the relevance of the target reader who's there, who is mentioned in your case note. Now, reading the case note, make sure when the question paper is there in your hand, read the first 5 lines of the case note. Okay. By reading the first 5 lines of the case note, you will be very sure who's the patient. You will be sure what is his age, whether you're talking about a patient who is male, female, the gender, what's the age of the patient. Also, in some letters, you may also get what is your position. Are you a nurse? Are you a doctor? Are you a general attending physician, general practitioner? What is your position? You'll get to know from the first 5 lines. Then don't read anything else. Directly turn your page, go to the last event, that is last date which is given to you, or probably in discharge letters, those are the discharge plan. So read that discharge plan along with your writing task. Writing task is the question, the writing task which is given to you, that is using the information in the case note. Write a referral letter, write a discharge letter to so and so person. By reading this way, by reading the last 5 lines or the last event, you will get to know who is your target reader. First of all, from the last event, you will get to know what is the current situation of the patient, what is the current problem for which you are writing this letter. Sorry for that. You're writing this letter. Then you would get to know from the writing task, you'll get to know who is your target reader, who's the person to whom you're writing. Also, you will get to know the reason for writing this letter. Always in your last event, you will get to know the current problem, the current issue, which you can use it for the first paragraph. You will get to know what is the reason for writing this letter. Also, you will get to know who is your target reader. Because if you understand who is your target reader, half of your work is done. Because then you can choose information and you can logically think. Because see, over here in OET writing, logic definitely works. Only your language does not work. Even logic works. You need to make sure if your target reader is a non-medical person, in that letter, if you write about medicines, its dosages and all those things, it's of no use. You will end up losing your marks. If you're writing it to a medical person, yes, all those medicine, all those background, all those dosages, depending on the situation of the patient, you need to write. You need to think logically, what is the patient's condition, what kind of situation patient is going through, and what kind of information would patient require. That is something is required, okay? Now, read this. This is the first 5 minutes which is given to you. Okay, now imagine this is the question paper which is given to you. Now I have taken a sample question paper. Now after today's lesson, I'm planning to come up with such kind of lessons for different medicine letters, because medicine letters are very complex. I really want to help those doctors who are struggling to clear their OET. I'm going to come up with many medicine letters which are really complex. It will be useful for nurses and other profession as well, because if you are trained to solve complex case notes, whatever kind of case notes you get in your question paper, you will feel it very comfortable. So those kind of challenging case notes, I'm going to come with live lessons where I'll be discussing, and that will make it more simpler for you. Now this initial 5 minutes, if you read, I'll just give you 1 minute, just go through it. I just want people who are attending this just to read this, just go through it. Just go through it. I'll just give 1 minute, not more than that. Just go through it and understand what kind of information is given over here. Okay, I'll just give 30 seconds more. Just go through it. Okay, perfect. Now understand this. Over here, what you can see is, wait a minute. Now, over here, what you can see is in the first line, it says you're a nurse in a community health center. So your position is very clear. You're a nurse in the community health center. Now, let me take my annotation key so that I can spot the things well for you. Wait a minute. Okay, it doesn't work this way. Okay, now let's understand this. Over here, the things what is given to you is the information which is about you're a nurse in a community health center. A patient you have been monitoring is moving to another city to live with his daughter. Okay, now from the first 2 lines, the first line itself, we got to know you're a community center. Here, a patient you're monitoring is moving to another city to live with his daughter. Okay, so there is nothing, a medical emergency or nothing as such, there is nothing given. There is a patient who was under your care, under your community center, is going to another community center, maybe to another place with his daughter. The name of the patient is given, Peter Dunbar. Then you can say date of birth, 18/3/1932. Then you have some current medication. So like even from the current medication, you can make a guess like, okay, this can be a diabetic patient or a hypertensive patient, because metformin, ramipril, warfarin, solotil. So some cardiac trouble, some blood pressure, or maybe a diabetic patient. So we'll read the rest of the letter and we'll get to know what exactly it is. But you will not waste your time in the initial 5 minutes. You will not waste your time to read the entire letter. In the first 5 minutes, out of that 5 minutes, the first minute, you should just read the first 5 lines, then go to the last event. Now, I'll just change this page and I'll show you the last event and the last. If this is the end of your page. Now the last event and the task, you will understand the last event over here is 22nd January 2019. Now read this. Now it is very clearly given, patient attended with daughter, patient moving to Centerville to live with his daughter and her husband. Daughter will cook, requires regarding patient's need and monitoring. Daughter advises that patient resistant to dietary alterations and medical regimens, still misses or double doses information. Letter to transfer the patient to the care of the community nurse in Centerville, where patient is moving to live with his daughter. Things are very clear. Now, initially we got an idea like patient is moving to another community center. When you read the last event, you get to know, fine, now the patient is going to Centerville to live with his daughter. Using the information in the case note, now writing task. If you read the writing task, you'll understand using the information given in the case notes, write a letter to the community health nurse in Centerville outlining the patient's history and requesting ongoing monitoring. Now, to whom we are writing? We're writing it to community health nurse. Now, this can be also to a general practitioner. These kind of letters can be to a doctor, can be to a nutritionist. It depends. But I'm just showing you one of the example wherein at this present, if we go with this case note, it's very clear. This letter is, we are writing it to a community nurse in Centerville who will be taking care of the patient, who will help with the further monitoring. And from the last event, we got to know patient is non-compliant to drug. Patient still takes misses or double doses the current situation. Patient is getting transferred to Centerville. So we got a little bit of idea. Fine, patient is non-compliant to medicines, non-compliant to things. We got to know patient is moving to Centerville along with his daughter. So he would require the further care and management. Now at this point, once you read this way, once you're very clear what is the patient situation, once you're very clear what is the current scenario, what is going through, who is our target reader, then read the entire letter. You will be pretty clear with this, okay? And you will be able to formulate your first paragraph clearly. There'll be no trouble with that, okay? Now what we'll do is we'll go to the discussion, okay? Now I'll take a live case note. I'll keep it live in front of you. And I'll show you like how can we do this, how can we read this, how the things can be pretty clear to you, okay? I'll display a question paper. I'll take an official question paper. And at the end of the lesson, what I'll do is, I'll also send you a sample answer in the comment box. If you have any questions related to this discussion, if you have any questions related to this question or this task which we are discussing, you can put it in the comment box and I can make sure that I'll answer that for you. After this lesson, I can answer each one by one. Whatever questions you have in terms of writing, I can answer that for you. Okay, now let's move on to the question paper. I'll just share it on the screen. Just hold on for 30 seconds. Okay, here we go. Now everyone can see this. This is the question paper. I'll just share it to a full screen where things will be easy for you. Here we go. Perfect. Now, I believe everyone can see this letter very clear. Now, over here, what we can see is, we can see, like I have shared in the screenshot in the presentation as well, that you're the nurse in a community center. A patient you have been monitoring is moving to another city with his daughter, Peter Dunbar, metformin 500 current medication. And also we can see diagnosed with type 2 diabetes since August 2016. Then we directly move on to the next page of this task, wherein we read the last event and we get to know, okay, patient is a diabetic patient. Patient is moving to Centerville along with his daughter, and she would require the further management techniques or further management advices. That is what we need, advice from the target reader. That is the reason we are sending this letter. Now, what we need to do is, when we get such kind of letters with so many dates, because I've seen candidates getting really worried when they see such kind of letters, like how should I take all these informations together? Now over here, there is one peculiarity. What you can see is there is only month and year given. There is no particular date given. Okay, so only for the most important event which you feel in the background, or most important event which you feel need to be reported, only for those events you use timeliners. Don't do it for every time. It is not required that you need to do it. For this, what you have to do is you will have to understand the patient's story very well. Okay, you should be able to understand what has happened in the background with the patient, what has happened currently, and what we need from the person. This is something is required when you are writing an OET letter. Now, if you move on to the first paragraph, the first paragraph is pretty simple. Thank you for accepting Mr. Peter Dunbar, or I'm writing in reference to the above mentioned patient who is diagnosed with type 2 diabetic mellitus. That is what the diagnosis currently patient has. And the current medications also is for that. Okay, you can see other medications, that is warfarin, solatolol, that will explain why that has been taken. But our current problem right now is patient is unable to maintain his medication regimen. Patient is not able to maintain his blood sugar levels. That's the reason we are sending the patient is moving to Centerville along with this. Now this community nurse has to take care. Community nurse has to advise the daughter what has to be done. So who is diagnosed with type 2 diabetic, and he is moving along with his daughter, and she would require further advices to comply with his medication and dietary regimen. That is what our first paragraph is all about. Okay, so first paragraph is pretty clear. We're writing in reference to the above mentioned patient, or writing in reference to Mr. Peter Dunbar, an old age man who is diagnosed with type 2 diabetic mellitus, and he's moving to Centerville along with his daughter, and she would require the further advices to comply with his medication and dietary regimen. That becomes your first paragraph. Now let's move on. The second paragraph. See, normally when we write a normal referral letter or a normal referral discharge, or whatever it is, whatever kind of letter you're writing, if the letter is not an emergency situation, there is no life-threatening situation, because over here it's just type 2 diabetes, patient is moving to Centerville. When there is no emergency situation, the background will be always about the patient's background. The second paragraph will be always about the patient's background. Okay, now when we look at the background, we can see there are something current medications given over here, and there are a lot of dates given over here. Now, from this case note, what we need to do is, now we cannot do a discussion in this. That's the reason what I'll do is I'll directly tell you what all informations you can take in over here. Now, over here, when we look at the background, we can see September 2017, December 2017, March 2018, June 2018, then June to August 2018. Then in the next page, on the next page, if you see, there are 2 days, that is October 2018, and this is 22nd January 2019. So this is the most recent event. This is something which is happening today, and we're writing this letter, that is the present day. And if you see, October 2018 is the most recent event which is given in the letter. So what we can do is, this treatment record, that is June 2018 till here, we can summarize all these information together. Okay, now understand this. Many people, when they write such kind of letters, what they do is, since they have given the current medication, there are 4 drugs given. Most of the candidates, they write all these 4 drugs together. Patient's current medications are metformin, raniprazole, warfarin, and solatolol. That is the way you write. Most of the people I've seen, that is the way you write. But don't write that way. If you find relevant disease conditions along with this drugs, then write it along with the disease condition itself, so that your reader will have a flow. Enlisting things will not make any sense. It will not show that you have good sentence structures. So this is something you should keep in your mind when you are doing such kind of letters. Now, if we summarize this background of the patient, if we summarize the target or the treatment record, then we need to be very sure that we only take those information which is required for the target reader, which would actually make any difference to the care provided to the target reader. Okay. Now, over here it is given diagnosed with type 2 diabetic mellitus since August 2016. So initially his blood sugar levels were 9. Okay. So we don't need initially, because this is not, we are not writing it to a doctor who is going to plan some treatment. So initial what blood sugar levels he came with, it's not that important. He was initially diagnosed with type 2 diabetes since August 2016. Then the important information we can see is GP recommended dietary regimen: low fat, low sugar, calorie restriction, limit alcohol, increase exercise. Patient lives at home with wife cooks, wife managing dietary requirements, but patient likes to have 2 to 3 glasses of wine with meals. What you should do right now is you should just read, understand the initial 5 minutes, understand what the question is, or what the information is given about the patient's background. First, let's take all information, let's understand what the informations are given. Then collectively what we'll do is we'll pick up only those information which will make sense which will narrate a story about the background of the patient. Okay, now we can see over here, initially this was the thing in September 2016, 2017, then we see December 2017, his wife deceased, which means the wife is no more, his wife has passed away, post which he was depressed and grieving. Patient was referred back to GP in monitoring or medicating, fasting blood sugar level is 9, patient non-compliant with diet, excessive fat, sugar, salt and alcohol OVN, he's having in excess. Then you can see in March 2018, patient was prescribed with metformin, that is oral hypoglycemic agent. Now patient cooking for self, non-compliant with diet, non-compliant with medication, blames poor memory. This is a very important information, because if patient is complaining that because of my poor memory, I'm not able to take my medicines on time, I'm not able to be compliant with my diet, then that's an important information to inform the other target reader, because his complaint would persist even now. He says, I have a poor memory, he's oldish man, I'm saying I still have a poor memory, and I cannot take medicines on time. That is an important information. Now, what we can see is, now, when you're writing a letter, if you have given any education to the patient, if you have given any assessment to the patient, you have advised something, that is always important in any letter. In any case note, if you write, if there is an information which you have given to the patient, some education you have given, some new drugs you have started, or some dosages you have changed, or patient says that this particular drug has worked well for me, if it is relevant to the current condition, yes, that informations are always important. Now, blames poor memory, patient appears unmotivated, resents having to take medication. Resent means he is reluctant, he doesn't want to take, always been healthy, takes medication intermittently, encouraged to take regularly. Patient was encouraged to take medicines regularly. Educated, that is something important, which you have educated the patient, which you have given the education to the patient regarding need for regular medication and potential adverse effects of intermittent dosing. Discuss strategies of memory aids. So this is a solution that you have tried to give this patient. Patient blamed poor memory is the reason I'm not able to take the medicines on time, and I'm not able to comply with the advices for dietary regimen, for which patient was discussed with memory aids. Then we see patient hospitalized, City Hospital Newton with myocardial infarction following retrosternal pain, nausea, vomiting, dizziness, sweating confirmed by ECG. Treatment aspirin, streptokinase infusion, prescribe Ramipril 5 mg daily. Okay, this Ramipril is also there. You can see it over here, which is there in the list of current medication. Over here, the metformin, which was given diagnosed with type 2 diabetic mellitus, and March 2018, patient was prescribed with metformin. Yes, that is over here. So when you write this information, patient was a sufferer of type 2 diabetic mellitus, which is managed with metformin 500 mg. And when you write in June 2018, patient was hospitalized with myocardial infarction following retrosternal pain is not that important, because that time what kind of symptoms he has shown for this myocardial infarction is not important. Myocardial infarction is important. On the same day, you can see patient has also been diagnosed with arterial fibrillation, for which he's commenced with solatolol and warfarin and prescribed Ramipril 5 mg. So we have got all the drugs which is there in the current medication. When it was started, we are very clear with it. But now, when you're writing this case note, the relevance has to be maintained. So out of this background, the most important information what you find is something which you should mention first, because that will make the reader feel the relevance of this letter. He will understand the most important priority thing. He'll be able to know about the patient, which will help him or her in taking care of the patient very well. Now, out of this background, if we want to summarize this story, I'll tell you what all information we can add up from this. Everything is not required. Now, initially, when you start the second paragraph, in terms of his medical history, patient was hospitalized in June 2018, where he was diagnosed with, at City Hospital Newton, where he was diagnosed with myocardial infarction. Now, following retrosternal pain, we don't need this information. Nausea, vomiting, we don't need this information. Dizziness, sweating, confirmed by ECG, no. The reason why don't we need this, right now the patient is suffering of type 2 diabetes, we're just sending this patient for the care, but we need to inform the patient has suffered a confirmed diagnosis of myocardial infarction. That's all is enough. Don't go into the depth of what has happened in the past. If you know the diagnosis, the main reason of that hospitalization, only that is enough. Then in treatment part, you can see aspirin. We don't need this because that is not part of the current medication. Then we can see streptokinase infusion, which was the beginning therapy which they give. That is not required because that is not part of the current medication. I have seen people making mistakes of involving even these informations. This is where you will lose your marks. Okay. Prescribe Ramipril 5 mg daily. Yes, that is required. On the same day, you can see in June 2018 itself, there was no re-hospitalization. On the same day, he was diagnosed with arterial fibrillation post-MI, for which he was commenced with solatolol and warfarin. So this is how you should write your drugs along with the disease condition. Things will be very easy for you, because this way, if you understand this, any other information what we need from background, we got to know from what we got to know from this is, we got to know patient was diagnosed with type 2 diabetes since August 2016. And he was managing very well with his own. Post his wife's death, he has been non-compliant with his diet and medication. His sugar levels have been managed with metformin 500 mg. For his non-compliance, he blames poor memory, for which we have discussed strategies of memory aids. Okay. Now, once you mention about the hospitalization due to myocardial infarction, due to the arterial fibrillation and the drugs which is currently going on for that, plus after that you come to this, like in December 2016, post his wife's death, patient has been non-compliant, for which he blames his poor memory, and we have discussed the strategies of memory aids for the improvement. Okay, if you take it this way, so how many information we got? We got myocardial infarction and arterial fibrillation 2 information, wherein the drugs are also involved. 2, patient is diagnosed in August 2016, that is 3. Patient wife death, that is 4. Patient being non-compliant, that is 5. Patient blames poor memory and discuss strategies of memory aids, that is 6. So in a paragraph, don't go more than 7 information. 5 to 7 information is something what we need in the background of the patient. So when we read this question paper, this kind of question paper, first read the first page, understand the background of the patient, then try to summarize, then to try to narrate a story about the background of the patient in your own words. That is something is required. If anyone wants to take a screenshot of this, because this is an official letter, this is also available free of cost. Like it is, like there's no charge, nothing. It is available on the OET official site. You can just download. I just wanted, because such kind of complex letters, candidates do find difficulty to understand how to write and how to pick up information. So if we write our second paragraph, it is pretty simple. In terms of his medical history, he suffered a myocardial infarction for which he was hospitalized at City Hospital in Newton. Over there, he was diagnosed with arterial fibrillation as well on the same day, and was prescribed with warfarin and solatolol. Okay, and his hypertension has been controlled by Ramipril 5 mg. However, he's non-compliant to all his medication post his wife's death, reporting poor memory as the primary cause, for which we have discussed the strategies of memory aids. See, we can see a lot of dates over here. We can see 5 to 6 dates over here, but we take only 6 information. We summarize it all together. This skill is something what you need to learn. And from these kind of discussions, this is something you're going to learn. Now, we have done with this entire, we'll move on to the third paragraph, which is about the most recent event. Now, in the recent event, what you can say is, patient is now walking with a stick. Signs of diabetic neuropathy. So that is an important thing which we need to say. Like since October 2018, Mr. Dunbar has shown signs of diabetic neuropathy. Okay, poor exercise tolerance, which was already there. Restricted mobility. Yes, that is something which is important. Non-compliance with diet continues. So we don't need to repeat this because we have already said in the second paragraph he's non-compliant with this diet. Still self-catering, discuss alternatives. Yes, discuss alternatives. So you can say, okay, alternatives were discussed for the patient. He had respiratory infection 2 weeks ago. This information is not important, because for which amoxicillin was prescribed, because this was something in October 2018, 2 weeks ago. In this visit, he said 2 weeks ago he had respiratory infection for which the amoxicillin was prescribed, but that is not the part of the current medication. Hence, we don't need this. Patient discontinued all the other medication as felt unwell. Resume medication, but still only taking intermittently. Again, provided education. So this is something which you will have to write. Okay, you can write on contrary to advices regarding the importance of adherence to drug regimen, patients still being non-compliant. Okay, so your third paragraph you can write, since October 2018, Mr. Dunbar has shown signs of diabetic neuropathy, hence walks with the help of a stick. then what he has now, then he's resistant to any type of treatment and has been non-compliant to all medication regimen on contrary to advices. Then comes your last paragraph, that is about the fourth paragraph. Patient attended with daughter today. Patient moving to Centerville to live with his daughter, with his daughter and her husband. Daughter will cook, requires education regarding patient's need and monitoring. Daughter advises that patient is resistant to dietary alterations and medication regimen, still misses or double doses. This is the most important information. If the patient is missing or double dosing the information, that is something which you will have to make sure that you inform the target reader. Refuses to reduce salt, sugar, alcohol, fatty food. We have said the patient is non-adherent to diet, so no need to repeat it. Okay. Patient continues to require monitoring and encouragement. Letter to transfer community health nurse in Centerville, where the patient is moving to live with his daughter. Now over here, what we understood from this is patient is moving to Centerville along with his daughter. Daughter will be cooking for him, and her daughter would require education regarding patient's needs and monitoring. Okay, and patient's daughter has advised that or reported that patient still misses or double doses the information. So here the things are very clear. So we will read currently he would be moving to Centerville along with his daughter, while his daughter will be cooking for him. She would require, who? This person, not the patient. This daughter, she would require some guidance related to his medication regimen as well as dietary regimen, as she has reported that he still misses or double doses the prescribed medicines. Okay, this is how you can write your letter. This is what your fourth paragraph would be. Then you can just close your letter. It would be greatly appreciated if you could provide ongoing monitoring and guidance for Mr. Dunbar's optimum recovery. That is what your closing is. Then if you need any further clarification, please do not hesitate to contact me. That will be all for the letter. So information, picking up information, you should be able to summarize. That is something which I wish to share, and I wish to add it as a closing for this lecture. Make sure whenever you write a letter, read the first 5 lines, read the last event and the question task which is given to you. You will be able to understand who is the patient, what is his age, what is the diagnosis, what is the current situation, and what is the purpose of writing this letter. Because if that is clear with you, that the reason for writing this letter, if you're clear with that, things will be pretty easy for you. Okay, and summarize information. Many people have a mistake. They read 2 lines from the case notes and they formulate 1 line in their answer paper. Never do that. Because if you do that, you will understand you have ended up writing just note forms, which you normally write in your patient's file, or you write it as a nurse's notes. Doctors do write their notes in the on their file, patient's file, the same way we write. We don't write using grammar and sentences. What we do, we just write everything in the note form. Okay, so please keep this in your mind. Keep these things in your mind when you're writing a letter. We need to narrate a story about the patient. Now, narration should have all the relevant information which is relevant to the current condition of the patient, the current diagnosis of the patient. Okay, so I believe this was useful and helpful for all of you, those who are preparing for your OET examination. If you have any doubts in terms of this letter, you can comment in the comment box. Please make sure, if you guys are live and attending this lesson, please make sure you comment in the comment box that you have attended this lesson, so that we can know that how many people are attending, and we can send you all the sample answer for this letter. Things will be more easy for you. I'll send you the question paper and the sample answer. If I'm not able to send to you personally, I'll make sure I'll send it I'll put it in the comment box. But I want everyone to mark the attendance, because that is a motivation for us to come up with such lectures which will be beneficial for you. We are not charging anything for these lectures, but we are uploading on Facebook. We also have a training program which helps candidates to help or prepare in a much better way. You can contact us for that. If you want some help with the lessons, intensive lessons, if you need some help, you can definitely contact us through the comment box. I'll be putting my contact number, my personal number. You can contact me on that. Thank you so much for joining in. Have a beautiful day ahead. Bye, people.